At first glance, the savanna seems calm. Sunlit grassland stretches quietly to the horizon. Yet vigilance rules here. Unseen eyes watch. Stillness tightens the air. Predator and prey hold a fragile balance. Between routine and risk, tiny signs matter. Here, the black mamba appears, alert and conflict-averse. Its reputation is vast, its presence deliberate. A highly adapted, elapid navigating scrub, rock and grass. It does not hunt people. It avoids unnecessary confrontation. Respect stems from potent neurotoxins, speed and composure. The black mamba, Dendroaspis polylepis, is elegantly built and formidable. Its common name is misleading. The body itself is not black. Dorsal coloration ranges from olive to taupe and grey with a smooth satin sheen, sometimes brownish or a cool gunmetal grey. The black refers to the inky pigmentation inside the mouth. When defensive, it raises the front of the body, slightly flattens the neck and gapes to display that dark oral lining. The gape is a warning, revealing a lining as dark as ink, not an invitation to attack. In size, it is among Africa's longest venomous snakes. Typical adult length is about 2.0 to 2.8 meters. Large individuals may exceed 3 meters. Reports of maxima near 4.3 meters exist, though such extremes are debated and rarely verified. The body is long and relatively slender, aiding rapid, efficient locomotion. Despite its length, it remains notably agile. The head is narrow and coffin-shaped, the eyes large with round pupils. Smooth scales contribute to a subtle sheen. In motion, it appears to flow over the ground, head often held slightly elevated. Its reputation for speed is deserved, used chiefly for escape, not pursuit. Field reports and time tracks place the black mamba among the fastest land snakes. In short bursts, it can reach around 20 kilometers per hour over only a few meters. On rough ground, that's quicker than many people can manage at a sprint. Crucially, this pace is for breaking line of sight and reaching cover, not for pursuing people. It uses quickness to evade threats or to close the last meters on prey already targeted. Small birds and rodents. Viewed at ground level, the body lifts and skims, a low, fluid traverse through scrub. Size, speed, and a stark mouth gape when pressed make it a formidable prospect. Everything about it suits active hunting and rapid withdrawal. Relatively large eyes confer sharp daylight vision, augmenting scent and vibration cues for precise strikes. Yet its default choice is caution. Flight is the most common outcome. Long ribs, strong trunk muscles, and a narrow build favor efficient motion across open savanna and stony slopes alike, an elegant solution to a demanding habitat. The black mamba's fearsome reputation has a biological basis. At its center is venom that targets the nervous system. It is a precise chemical cocktail acting rapidly at nerve-muscle junctions. Unlike many viperid venoms that are hemotoxic, damaging tissue and affecting the blood, Mamba venom is chiefly neurotoxic, interfering with how nerves signal muscles. Key components include dendrotoxins, which block potassium channels, and alpha-neurotoxins that bind nicotinic acetylcholine receptors. Together, these disrupt neuromuscular transmission, so nerves fail to activate their target muscles. Signals between brain and muscle falter as synapses are blocked. Weakness develops and spreads. In simple terms, the body progressively loses voluntary control, culminating in paralysis if untreated. When a mamba strikes defensively, contact is brief but efficient, delivering a measured dose. If escape is blocked, several quick bites may occur in succession. Each bite may inject a modest volume, yet the potency and rapid uptake make prompt care essential. Dry bites are possible but must never be assumed. Once in the bloodstream, effects often begin within minutes as neurotoxins take hold. Early symptoms can appear swiftly. A victim may notice tingling at the bite or around the lips, paresthesia, and a sense of limb heaviness. Ptosis or drooping eyelids may follow with slurred speech, dysarthria, and confusion. Difficulty swallowing, dysphagia, can develop, then progressive breathlessness as respiratory muscles weaken. The venom circulates through lymph and blood, interrupting the nerve signals that govern voluntary muscle control across the body. The most critical concern is breathing, as respiratory function can be compromised early in severe envenomation. As paralysis spreads, it involves the diaphragm and intercostal muscles, reducing chest expansion and the effectiveness of each breath. Breathing becomes shallow and infrequent. The effort to draw air increases progressively. Without timely medical care, this progression can culminate in respiratory failure. The heart may continue briefly, but inadequate oxygen soon injures the brain and other vital organs. Before specific antivenom, mortality was high. Severe cases could deteriorate within 20 to 60 minutes, varying with dose, bite site, and the patient's size and health. Today, a Mamba bite remains a medical emergency requiring rapid transport, monitoring, and supportive care. Early administration of the correct antivenom by trained clinicians markedly improves survival. Antivenom is produced from antibodies raised against Mamba venom, carefully purified for clinical use. These antibodies neutralize the neurotoxins, halting progression of paralysis and allowing breathing to recover with supportive measures. In remote areas, limited access to clinics and stocked antivenom increases risk and makes time to treatment pivotal. Practical outcomes hinge on time. Immobilize the limb, stay calm and still, and seek immediate care. With rapid treatment, most patients recover. Delays increase danger. If you encounter a black mamba at close range, stop. Hold still, lower your shoulders, and avoid eye contact or sudden gestures. Assess distance and exits. Identify a clear route the snake can use to reach cover. If it orients toward cover and begins to move, remain stationary and give space. If you must leave, step back slowly, one pace at a time, keeping natural obstacles between you and the snake. Do not attempt to handle, capture, or kill the animal. This escalates risk. If the snake remains within living areas or cannot retreat, contact trained wildlife personnel. In nature, potential predators such as mongooses test boundaries. Most interactions end in withdrawal, not a fight. Each side manages risk. Neither seeks commitment when retreat is available. If a mamba raises its head and gapes, freeze and allow it a path to withdraw. Maintain line of sight, keep pets and children back, and avoid running. Calm behavior and distance produce safe outcomes for both people and the snake. If it pauses to display a warning gape, wait. When it turns away, let it go. When backing away, watch your footing and move slowly. One steady step, then pause. Once clear, note the last location and inform others nearby to avoid the area. Allow retreat to cover. De-escalation complete.